In May of 2007, we rescued 4 tigers from a breeding facility in Florida called Savage Kingdom. Savage Kingdom had a long history of big cat escapes and attacks that resulted in injuries and deaths for both humans and cats. These were documented in an episode of Animal Planet's Fatal Attractions featuring Big Cat Rescue. The facility was finally closed by the USDA in 2006, ending the breeding and abuse. Ma Nick, a female tiger who was 14 years old at the time, was one of the cats we rescued that day. Facilities like Savage Kingdom breed their tigers continuously, so they can sell the cubs to be used for petting sessions and as photo props. In the wild, tigers give birth to cubs every 2 to 3 years, but in backyard breeding facilities like Savage Kingdom, the tigers are bred 2 to 3 times per year, so they have a constant supply of new cubs to sell and exploit. This, of course, takes a physical and emotional toll on the mother tigers like Ma Nick. Ma Nick settled in well to life at the sanctuary. The other tigers we rescued from Savage Kingdom were TJ, Bella, and Ma Nick's sister Trusha, who we unfortunately lost to cancer in 2009. Ma Nick often greets her keepers with a chuff, and she lives in the outback section of the Big Cat Rescue next to Flavio and the 3 tigers we rescued from Texas, Andre, Arthur, and Amanda. In 2011, keepers noticed that Ma Nick had an ingrown claw. We managed to verify this using operant conditioning. This allows us to observe our cats up close from different angles on a daily basis. With Ma Nick sedated, we were able to treat her ingrown claw, trim the rest of her claws, and at the same time, local eye specialist Dr. Miller evaluated and measured Ma Nick's lenses to use as a model for lens replacement for tigers with cataracts. This is pretty common in tigers who may have a genetic predisposition or may have had poor nutrition as cubs.
They can get high blood pressure, they can get cataracts, they can get uveitis and lens luxations, and all those things are can be painful. And so one of the things I'm checking for is to make sure that she doesn't have any of those things. And so far she doesn't. And then the ultrasound that I'm doing is just to look and see the size of her lens. So I'm measuring the size of her lens in the adult tiger, because a lot of young tigers, when they're hand raised, they actually develop nutritional cataracts, and because of that we end up having to take their lenses out, and we're trying to figure out what size lens, a man-made lens, we can put back in.
We performed a physical on Ma Nick and discovered mammary tumors. We took samples to be tested, and unfortunately they turned out to be cancerous. While we were deciding the best plan of action for Ma Nick, keepers spotted a mass protruding from under her tail. We decided to schedule Ma Nick for surgery. Unlike the relatively simple procedure that we had performed in her enclosure, this major surgery required a powerful X-ray machine to see exactly how far her tumors had spread, and obviously a sterile environment if we were to proceed with the removal of the tumors. So for the first time, we transported a tiger from the sanctuary to a veterinary clinic for a surgical procedure. Once we arrived, we had to sedate Ma Nick. I distracted her at the front of the transport cage while Jamie injected her with the drugs. You may not have noticed then, but if we rewind the clip and play it again, you see that Ma Nick's reaction to being injected forced the pole syringe handle into Jamie's neck, leaving her with a memento of the day. We waited for the drugs to take effect and then transported her inside. X-rays were first on the list. Thankfully, they showed that the cancer hadn't spread, so removing the tumors would lessen the chance of it spreading in the future. We then transferred her to the surgery room. The mass protruding from her vaginal area was removed. We ran tests on the tissue and found that it was a polyp, which is an abnormal growth of tissue projecting from a mucous membrane. For this video, we spoke to a reproduction specialist and found that polyps are more common in dogs than cats, and no one really knows why this happens. It may be due to the constant breeding that Ma Nick had to endure, but old age seems to be the most common factor, and surgical removal is curative. Ma Nick was then prepped, the tumors were removed, and the surgery was a success. When the sanctuary's volunteer vet, Dr. Liz Wynn, isn't performing the surgery herself, She's always assisting with the procedure to help veterinarians who are more used to dealing with domestic animals. The area was thoroughly cleaned, and we then loaded Monik back into the transport cage, the trailer, and then returned to the sanctuary. She spent 2 weeks in our quarantine area before being moved back out to her enclosure. Monik's receiving daily meds, she's eating well, and she's receiving lots of attention. We're so thankful that because of our supporters, we can continue to provide the best care for our cats. Many of them start life in bad situations, but once they're a Big Cat Rescue, we try to make them as comfortable as possible.